Thanks to everyone for coming. I'm very glad to be here. It's the first speaker for the exchange for the semester for this academic year. So it's really exciting that I get to be here, hoping to kick things off. And also kind of introducing some of you probably for the first time to the Osher Center for Integrative Health. How many of you have heard of the Osher Center before? So a few folks, for those of you who are unfamiliar. Osher Center for Integrative Health is here at UVM. It's situated within the university, kind of similar to the Gund Institute. And the differences are that it's really focusing on helping to connect people within the healthcare realm. So we have a lot of clinicians, doctors, nurses, people who are in social work, practitioners who are practicing complementary therapies, acupuncturists, chiropractors. We'll get more into that as we go through the talk. We're really coming together around providing integrative healthcare, which again we'll get into more. And my role there is really thinking about how do we provide healthcare with a planetary lens to make sure that the care we are providing is not actually harming the greater population in some way, which is where my work really focuses. But to get us started, how many of you have seen this image previously? This came out in Forbes a few years ago. And I really like it because it helps us just situate how do all these different components factor together. So we have here at the smallest circle, individual health. This is the level at which healthcare in the United States functions. Really looking at a single person and what can we do to help improve their health or overcome illness. Public health, the next realm out, looks at the health of populations, groups of people, in all sorts of different ways. This is where we start to see epidemiological research and different abilities to look at health within groups. Global health of people around the world with a real focus on thinking about equity, health equity around the world. One Health brings in the additional layer of animals, particularly wildlife. You might see examples of One Health. How many of you are familiar with One Health in this room? This one I would expect many people in guns to be familiar with. Like one key area where we're seeing One Health is thinking about diseases that are transmitted back and forth between animals and humans. And then Planetary Health really kind of pulls all these things together within a broader lens to think about what are the different systems, urban systems that we as humans, our societies rely upon in order for our health at all these different levels to function properly. So that's what planetary health really thinks about, and we'll dive into this a little bit more as we go. So how many of you have seen this image on your left, the 9 boundaries for planetary health? It's becoming more popular. It's been out for a number of years now. And this is really kind of the beginning of thinking about visualization of what are the 9 planetary boundaries that help us understand the health of our Earth systems. So, right, these will be familiar to many people in this room. Anything from climate change, novel entities. In my realm, this means things like pharmaceuticals entering the environment. So things like synthetic chemicals. What are we doing? What are we putting out into the environment? Stratospheric ozone, atmospheric aerosol loading. Things I like to describe to my students when you see like black soot emitting from factories or diesel trucks going by, that'd be that sort of aerosol loading. The acidification of oceans, this is a boundary. Biogeochemical flows of phosphorus and nitrogen, mainly from our agricultural systems, freshwater use, land system change, things like cutting down forests, and then the integrity of our biosphere, so biodiversity. So these are the 9 boundaries. How many of you are familiar with this image of donut economics? I would expect many people in the Gun Institute to be very familiar with this one. So this image is based on this. So it's taken these 9, and these are now the 9 outer layers here, and it's added in a threshold for an area of which we can't go beneath. So for the planetary boundaries, we can't cross over them. We're using, if we cross over these planetary boundaries, we are going above and beyond what the Earth can sustain for human civilization to continue. If we fall beneath this social foundation, which adds in these different areas, then we have this shortfall in which humanity itself is struggling. So this green zone represents the safe and just space for humanity to survive in. Hopefully now everyone is at least somewhat familiar, and you will likely, if you're involved in the GUN during coursework here, you will come across these more as you continue through. So planetary health, those 9 boundaries, has a healthcare problem. I played around with like, what's a good way of saying this? And this is what I think I came up with. Like, yeah, the health of our planet, the way that we are currently approaching healthcare, particularly in the United States, it's causing us a lot of problems for the planet. So what can we do about it? And that's what I'm excited to be here to talk with you about. But to help us kind of understand that, let's just take one commonly used material from healthcare settings, this being the IV, the drip, the bag, all the things that are in this image, the pole that's holding that bag, right, a metal pole, the plastics in the bag, whatever the chemical is, the pharmaceutical that's being used, they all come from the environment somewhere. They all have some sort of upstream home where they are harvested, processed, manufactured. There's a lot of energy that goes into that whole system. Here, when they are used very briefly in the overall life cycle of this material, and then we dispose of them. And so throughout this whole system, this whole supply chain, there are several different environmental unintended outcomes that happen from that resource extraction, from the carbon that's used, all those different aspects, all the way down to what we're emitting into the environment. So just thinking about this one example helps us get a sense of, okay, healthcare has an impact here. How does that relate to all other aspects of healthcare? So this image comes to us from the Commonwealth Fund, and it shows us for all the greenhouse gas emissions in the United States healthcare industry, 82% of them are coming from these supply chains. So to me, that suggests that if we really want to focus on finding ways to decrease the carbon footprint of the healthcare industry, we have to think about this scope, those supply chains. What can we do to minimize the harms coming from there? And there are a few things we can think about. One might be the technology. How do we improve the processes by which we are providing these materials? The one that I'm more interested in, and the reason why I'm here to talk to you about integrative health, is how do we improve the system of healthcare, the way that we're actually approaching the patient in front of us, to rethink the way that we are approaching health for that individual, so that we're getting away from needing and relying upon all of these materials, and instead promoting the health of the whole individual, improving the health from the start, so that people don't get into a disease state where they need to come into the hospital and require all of these inputs. So that's what I'm here to talk about with the integrative health approach. So getting back again to this image, just to put us into this sense of, okay, how does planetary health have a healthcare problem? So climate change accounts for 8.5% of national greenhouse gas emissions, which is huge in comparison to other industries. If the healthcare sector itself were a country, it would be 13th rank overall for greenhouse gas emissions. So we're emitting a lot of carbon through all of these different processes. Novel entities, one of the areas that I've worked in most, pharmaceuticals. Prescription drugs account for 10% of that total, which is a very large share of any particular thing. So the amount of prescription drugs we are using in this country is way higher than in any of our peer countries. What can we do to minimize our reliance upon drugs and instead, again, promote the health of the individual so that we don't come into a disease state where we need those pharmaceuticals? So that's the carbon component here. Another one, thinking again about this area of novel entities entering the environment. So pharmaceutical pollution has been detected in 80% of surface waters across the country. That just means our lakes and streams, all the fresh water that we've tested, 80% of those have come back with detectable limits of different pharmaceuticals. We've done some studies here in Lake Champlain that I've talked about before in Gund, and I'm happy to share some of that information for anybody who is interested. But just thinking about what are the impacts of this on the planet, and then how does that cycle back into human health? How are we being impacted by some of these different unintended consequences of medical care? This is what I'm really interested in thinking about on my own and thinking about with you all today as well. So one thing that has come up in conversations before is, okay, so we have these unintended consequences through the healthcare system, but aren't they kind of necessary? If we need to provide care to the person in front of us, isn't it necessary for us to have a footprint on the environment around us? And the thing I like to point back to is this image, which is now a little bit older data, right? It's back to 2015. We don't have a more updated image directly from our World in Data, great data source, but I can tell you that the trend is the same and even worse now. What this is showing us is basically life expectancy compared to overall per capita health expenditure. And this is the United States in red compared to our peer countries. And where you want to be is here, which would be a very low healthcare cost and a very long life. That would mean that we're doing a really good job of keeping people healthy through health promotion, not allowing people to enter a disease state. What we see instead, currently our numbers are, it costs per year $12,914 per year, so it's up from the $8,000. And our life expectancy has been lower. Our overall life expectancy now is 76 years, 79 years for female, 73 years for male. So we're spending a lot of money and we are not healthier for it. So that suggests to me, yeah, no, these externalities aren't necessary. There's something that we could be doing better that would actually promote health and potentially lower costs for us and have a lower planetary health outcome. So here's those updated numbers for the current time. So from my perspective, there's really this critical need for us to identify different paths forward. What can we be doing in healthcare that really promotes well-being at the individual scale and also doesn't have these outcomes for the planet? So I have researched beginning in end-of-life care, which is, thanks for the introduction to the book promo here. They have a new book out, and I'm happy to talk about it. There are copies available in the library. If you're interested, you can go and check it out there. So I started in end-of-life care, and one of the things that I found here, and I can talk about all of these things for hours, so feel free to chat with me after the conversation here, and I can fill you in more. But from end-of-life medical care, the main insight that I got there was that among cancer patients, which was the population I was working with, if patients and providers have clear communication with each other throughout the course of illness, and that if different options are provided to patients from the beginning, for example, when you are first diagnosed with an aggressive form of cancer, if you are told, yes, we have some treatments that can help us with cure, and there are other treatments that are available to us that will help you with comfort. And as we progress, we might have the opportunity to work with more palliative treatments that will provide more comfort as things change for you in your diagnosis. And maybe, just maybe, at some point we'll get to work with hospice. We're not there yet, but we might get to. And from the conversations I had with the physicians who were working in this realm, they felt strongly that if you just put out the term hospice from the very beginning as a positive option for some time in the future, people became more aware of what hospice actually is and less afraid of it. So that as they move through their illness, and if the curative cares don't work, and as palliative care becomes more useful in providing comfort to that patient, and they are nearing the end of life, the key is that then patients are better able to, and providers are better able to provide transition out of curative approaches that are not helpful anymore into palliative care and hospice approaches, which are the most helpful thing for a person at end of life. So it was all about open conversation about options and the ability to transition when it is most medically appropriate. It's not medically appropriate to provide chemotherapy to people 2 weeks before they die, and that is a standard practice that we are offering right now. So from that study, I started looking more into certain aspects, and pharmaceuticals became one of the most interesting areas that I looked into. And my focus here was many pronged, right? As many people in gut, we have many different interests. And one of the things that became most interesting to me is just when are we prescribing pharmaceuticals in comparison to other options that are available to people? So in the United States, we use more pharmaceuticals than in any other country. And again, thinking back to that, what's the benefit that it's giving us? We're not living longer for it. We actually have worse health outcomes in the majority of health outcomes that are tracked. We have higher rates of all sorts of disease, obesity, maternal mortality rates, all these sorts of things. So what could we be doing better that's not relying on pharmaceuticals? Because the more pharmaceuticals that are being prescribed, the more pharmaceuticals are ending up in the environment, simply because our bodies excrete them. Depending on the chemical, when we take the pill or drink the liquid, our bodies metabolize some portion of that active ingredient. But for example, acetaminophen, we excrete, we pee out 90% of the active ingredient. It goes into our wastewater, wherever that might be. Wastewater treatment plants are not able to process these chemicals. So they end up going out into our lakes and streams, which gets us back to that number of the 80% of surface waters have pharmaceuticals in them. So what could we be doing differently? We know that the pharmaceuticals are very useful in some cases. We also know that we're overprescribing them in many cases. Some of the areas where we see this most presently, and it might be most interesting to the gun, would be antibiotics. We know we have overprescribed antibiotics in the past, which has led to antibiotic resistance that we are seeing. And now some of the arsenal that we had available to us to help treat certain pathogens doesn't work anymore. We have resistance in the pathogens, and we can't effectively treat some of these diseases anymore. So we have scaled way back, and now when you go into your doctor's office and you have a cold, in the past you may have been given an antibiotic, even though a cold is a virus and it's not a bacteria. Only bacteria could be affected by an antibiotic. So nowadays, you'll be much more likely to have your physician come and speak to you about, like, oh, here's the supportive care that you need. You know, drink lots of fluids, get plenty of rest, just reduce your stress for a couple of days and you'll get better. There's no drug, there's no antibiotic that I can give you that will help. We also see this with opioids, right? And the opioid epidemic that we're seeing. We prescribed a lot of opioids in the past for pain control. And we're seeing this in the news now with all sorts of lawsuits and what's happening with these things. And we're scaling way back. In certain circumstances, opioids are incredibly powerful and useful for people. In my experience, particularly with end-of-life pain, people who are experiencing cancer pain as they are dying, opioids are very useful in that population. And there are other populations as well. And in the past, we might give someone a 3-week prescription. And that is where addiction starts to become a possibility. Instead, now people are much more thoughtful about prescribing, and there are new best practices that are being followed for exactly how many pills can you give to an individual before you need to reassess and determine whether or not they still need that, or if they're ready for transitioning to something less or something different. So from that general area of work, I started seeing more and more of these other approaches that are available to people, which brings me to integrative medicine and the approaches that don't rely on these more conventional approaches, but have many benefits to human health. So this is where we're going to focus for the rest of our time here. So how many of you have heard the term integrative health or integrative medicine before? And how many of you feel pretty confident that you could actually define what integrative health means? Okay, a couple of people are feeling pretty confident. Our director of the Osher Center, excellent. We won't actually mention it here, but it is here you say what you have to say. So okay, this is a term that is floating around out there. We're kind of familiar with it, but what does it really mean? So in comparison, conventional medicine, this is like our current major mainstream healthcare approach, also called allopathic medicine, Western medicine, biomedicine. This approach has been around since like the 1850s or so, around the time of the germ theory of disease, the standardization of medical training and medical practice, really focused on this idea of biomedical. How does the body function? So looking at an individual symptom, figuring out the individual organ or body system that is related to that problem, and then fixing that one individual system or problem. So, right, like if you have if you have a cold, then focusing on that upper respiratory system, what are the things we can do to support that respiratory system? This model has been criticized for a number of years now as being sick care. We are only coming into our healthcare provider really when we are ill, and we're being broken into those individual pieces. We're just looking at this one body system. We're not looking at the whole person, and we're trying to just react an individual problem that's happening. In comparison, true health care is being touted as something that looks at the whole person, where we are looking at how do we prevent illness from ever happening by considering the person's physical health, which is what that conventional approach is, physical mainly, but also thinking about how does the physical interact with the mental. How does that interact with the social? How does that interact with the spiritual well-being of that person? And I would throw in the environmental piece as well. How does the environment that a person is living within contribute to physical, mental, social, spiritual? So how do we move from this model of sick care where we currently are into a true model of healthcare, which some places are starting to figure out? Let me give you one hint here. The U.S. Veterans Administration, the VA, how many of you have heard of the VA? This is where our veterans go to get their care. They very recently adopted a new model that's focusing on whole person health, where they're really trying to look at all of those systems together, not just picking apart the symptoms from the physical aspect, but how is the mental, emotional, spiritual well-being of this person actually leading to illness and disease that is manifesting in a physical way. Another thing to consider here is this 3-4-50 campaign. Has anybody seen the 3-4-50 campaign before? Just a couple people. So this idea is that there are 3 behaviors that cause the 4 diseases that kill 50% of all Americans. And so those 3 behaviors are lack of physical activity, poor nutrition, and tobacco use, smoking in particular. Those 3 behaviors lead to the 4 diseases: cancer, heart disease, type 2 diabetes, lung disease, that kill 50% of people. So in the conventional approach, we don't always think about how do we keep people away from these behaviors. We instead end up seeing them when they're already in the disease state, and then we try to pinpoint what do we do to overcome that cancer. with that healthcare system, where we're really looking at healthcare, we would focus more here on that public health and prevention aspect. How do we make sure that everyone has equitable access to places that are safe, natural spaces that we can go out and be physically active in without having to think about going to the gym? How do we just encourage people to walk to work, make sure that people live near where their work is? All those things that the GUND is so good at thinking about. How do we make sure that people have access to healthy foods rather than trying to overcome diabetes with drugs like metformin? How do we help with tobacco cessation, making sure that people either aren't starting or have ways to stop smoking rather than trying to treat lung disease after it had already started? So that's another of those kind of differences between the sick care approach and the true healthcare approach. So for example, here, just to put some numbers behind it, in Vermont, 47% of adults are not getting recommended physical activity, which is about 30 minutes a day. 20% report no physical activity. For the diet piece, nutrition, 61% of adult Vermonters don't currently consume recommended servings of fruit, 70% not getting recommended vegetable, and 16% of adult Vermonters. So if we can work on these three areas through a more real health promotion strategy, we can have a major impact on the number of people who are getting those diseases and dying from them. But we also have the capacity to extremely reduce the planetary health outcomes of healthcare, because if we can keep people out of the hospital where all of those different materials are being used, we can cut back that planetary health cost. So that was conventional medicine in a nutshell. Complementary medicine, this is a term for any non-mainstream approach that is used together with conventional care. So an example of this might be, instead of prescribing an opioid for pain, working with an acupuncturist, because there's a lot of good evidence for several areas where acupuncture is just as effective as a medication for controlling pain for. That's just one example. And that's where your primary care provider, conventional provider, is working alongside your acupuncturist, and they're both knowledgeable about working together. Alternative medicine is when an individual might go seeking care from somebody outside of the mainstream, where they're not really working together with their conventional physician. How many of you know someone who has ever taken a vitamin just because you think that that's good for you? So that's kind of alternative medicine, right? You maybe will report that to your physician, but if they haven't prescribed it, then that's really kind of a form of alternative medicine, because you've decided for yourself, I read this thing, I heard this thing, somebody else suggested this to me, so I think I'm going to take this vitamin because that's going to be better for me. Happy to talk to people afterwards about the actual limited evidence that there is on vitamins actually helping us. Vitamin D is the one vitamin that there's actually really solid evidence for it being useful in certain situations. There really isn't any evidence for just the general population to take any other sorts of vitamins. There are certain individual cases where vitamins can be very useful, and lots of people in our country take vitamins without really knowing how that evidence shakes out. And it costs us a lot of money, right? So that's kind of a curious component too. So integrative medicine is where it's an evidence-based approach, where your primary care physician and your complementary physicians are working together, complementing each other truly in this integrative approach, where your whole mind, body, spirit, social engagement, all of that is being taken into account to make sure that we are improving your health while you're still in the healthy category of this continuum, And once you are passed into an illness side of the continuum, providing supportive care through this integrative approach. So this is the long way of getting to the answer to that definition. How do we actually define integrative health? Hopefully now when you leave today, somebody asks you, how do you define integrative health? You'll have some little way of thinking about, oh, integrative health is bringing these things together in a holistic way.
Can I add one thing?
Please.
Sorry,
Yes.
I didn't mean not to. I would say that definition is missing a piece, which is uses the least invasive approach first.
Excellent, thanks. And that gets to us with the planetary health piece as well.
Yeah,
right?
exactly.
Less invasive for the patient, less invasive for the environment as well. Thank you, Kara. And you can all trust Kara because again, the Osher Center, so definitely trust what she has to say here. So here are broken down the 5 key modalities of what integrative health is. So we start with those lifestyle tools. This is really preventive care, making sure that people have accurate nutrition for themselves, physical activity, stress management, nature contact can be a part of that. Sleep can be also added up here as well. The other categories are things that some maybe you've heard of, some maybe you haven't, but mind-body therapy. Some examples are meditation, yoga, biochemical. This could be functional foods, probiotics, aromatherapy would also fit in here, anything that's chemical and is interacting with the body. Biomechanical, this is thinking of the mechanics of the body, so thinking of muscles and spines and joints. So you're going to see spinal manipulation like chiropractics, for example, massage, physical therapy, and then bioenergetic, which, for example, would be Reiki, acupuncture. There are many more actual individual therapies that fit within these. These tend to be pretty common among people. So just to give you some example of what each of these different types of therapy would entail. Those approaches to help us overcome this healthcare problem that Planetary Health has. So here's this continuum. So you could imagine that at this far end, this is where optimum health is for an individual. A person is feeling really well and everything is working really well in their body. Their body is resilient. Any sort of perturbation, your body can overcome it. When you get a little cold, your body's immune system is functioning well. You can get over that cold. You have this continuum because on the other end is the disease, right? Something has gotten off in one of those many components of your well-being, social, mental, spiritual, physical. Something is not well, and now you've flipped over into this disease state. There are lots of examples that we could talk about here, and I'll leave those for conversation afterward, but just it's helpful for me to imagine this kind of continuum. So all those different aspects of integrative health can help keep people here through preventive care, through really identifying, what's the proper nutrition for this person? How do we encourage physical activity for this individual, the sleep, all those different stress management tools. That helps keep us here. Once we have crossed into that disease state, we can use integrative health as supportive care. So, for example, in place of pharmaceuticals, what might be some of those other things that are available to us in our integrative health toolbox that we could use instead of these more invasive therapies that have these planetary health outcomes. So starting here on this supportive care end, just that same image, just looking at it here, what are some of those things? So here are those tools we've been talking about. How might that then relate to the person and the planet? So overall, what we're seeing from the evidence that is currently available, and we need more evidence, and I'm hoping to encourage some people to come to us, to work with us, to think about how do we look at, how do we measure some of these things. But we're looking for better outcomes for both patient and planet and provider. We have a lot of burnout happening, and what we're seeing in the integrative health approach is that our providers are happier. They have more time, they're encouraged to take care of themselves. But back to here. So when we really provide this health promotion, we can decrease the rates of those 4 diseases that are causing 50% of us, right? We're just keeping people on the healthy side of that continuum. We have the co-benefits, right? Environmental co-benefits, climate co-benefits from plant-based diets. We hear a lot about that, right? Anything we can do to reduce our reliance and use of animal proteins, particularly that are coming from the confined animal feeding operations, right? Anything we can do to reduce our use of the mainstream conventional agriculture systems is going to have a benefit on carbon footprint through, transportation and the feeding of the animals, all these sorts of things. Similarly, for example, active transportation, if we're biking, walking, carpooling, all these different things to get to work, lower impacts on the planet, lower carbon, but also a benefit to our own well-being, because we know that these things are good for us. They help improve our well-being. And then here's the planetary health. Real input here is that we have less demand for those healthcare services and pharmaceuticals. When we're thinking about that supportive care side after someone has entered a disease state, so now we're on the opposite side of that continuum, we can still use those same lifestyle tools with nutrition, sleep, how do we encourage physical activity, because there's a lot of great evidence for people who are ill, who have better improvements, better outcomes through those lifestyle tools. But we can also really add in a lot of these other integrative therapies that help to overcome that disease state, get people back to feeling well from that whole person approach. So again, having better outcomes through this supportive care when someone is ill. And again, decreasing that demand for services in the healthcare system, decreasing length of stay. There's a lot of evidence from the areas that have been looked at currently that we just stay in the hospital for less time when we have some of these integrative approaches that are being used instead of just conventional. Decreased waste generation, because we aren't using all of those same resources that have that long life cycle. So briefly, I'm just going to share with you one of the areas that we are working on in the Osher Center that I think will be of most interest to you. So Farm Shares for Health, this wonderful person named Diane Imrie is the director of nutrition services at the UVM Medical Center. And about 10 years ago, she started a couple of different programs, one of which is called Farm Shares for Health, where she provides CSA, as in community supported agriculture, prescriptions for patients. This year, we are working with patients in our chronic pain program and patients who are receiving care for cancer. And we have about 60 patients who are receiving these CSA prescriptions free of charge for them. And what we want to understand is, what are the health outcomes for that person receiving this type of care in comparison to just standard conventional care where they aren't getting that nutrition support? We're curious about the community level outcomes as well. How does connecting the farming community with our healthcare system through purchasing food, how does that actually play out for the farmers? What are the barriers? What are the supports? What are the economics of that? Does it make sense? How do we make that work better so that we are encouraging more local agriculture within the healthcare system itself? And then the planetary health outcomes would be looking at how can we compare across people who are receiving a CSA prescription in comparison to folks who are still shopping at the conventional grocery store where they would have been. What's the greenhouse gas emission comparison of those different types of foods, of the life cycles of those foods? What's the difference in pharmaceutical use? People who have CSAs, are they reducing their reliance on pharmaceuticals for various things? How does that nutrition piece play into that overall well-being? And then just in general, what is the healthcare utilization? How many people are coming into the healthcare system as well? So these are all things that we're currently working on, though we have interest in all of these areas of looking across them to see what are the planetary health outcomes for all these different modalities that are currently available to us that have good evidence for positive patient outcomes. So in conclusion, the takeaways, our current system has pretty tremendous impacts, right? Thinking about that 8.5% of national greenhouse gas emissions, plus all those pharmaceuticals that are out in the environment. Integrative health offers us a promising avenue to help move out of that sick care and into healthcare that could really benefit people, patients, providers, and planet. We want to look more into this area. And I'll leave it there. And I welcome any questions that you have, and I encourage you to think about what are the things that you are currently working on that might play into this realm.